inflammation by my kneecap on my left knee. And I just wondered what you recommend.
On the more towards the inside or more towards the outer part of your leg? Like on which side of the knee is it?
The outer side.
The outer side. Do you wear high heels a lot?
I mean, 1 to 2 inches. That's...
Okay. And in years past, have you worn like high heels a lot?
No, not more than 2 inches. I was never a high heel.
Okay. That's good. The issue that can happen, so it's a little puffiness, or it's just like aches?
It's a little puffy, and
it's a little puffy.
And I know I can't put any pressure. I can't sit on my knees. I can't, when I cross my knees too long, I think maybe that's what's doing it. It doesn't have much, it's so easily hurt.
Okay. And has it ever been x-rayed?
I think so. I think they told me that there's not enough. They told me 10 years ago, 12 years ago, I'd need a replacement because there's not. Like
it's thinning cartilage.
Yeah, there's nothing in between.
So, because that's what I was trying to assess. Like either there's like thinning cartilage or a tear in the cartilage, or you could have iliotibial band syndrome, which is a big tendon that runs down the side of the leg. And athletes are prone to it, especially like skiing, running, tennis, cycling, things like that. But women are a little bit more prone to it than men, just because the pelvic bones are, a different shape for childbirth. So the hips are a little bit wider. That makes that come in at a bigger angle and can cause a bit of tendonitis down in that area. And so that sounds like a cartilage issue, though. So this is what I would do. I would rotate a couple of things. I would rotate. There's a blend called Joint Relief, and I would do it in an ointment or a liniment, and rub it. Ointment would probably be best. But rub it on that knee like daily. Like it could be the end of the day, it doesn't matter, but you're going to stimulate blood going into the area and then leaving the area. It's going to reduce some spasms and keep that area like well hydrated because of the blood flow. Anytime you have like thinning cartilage does not have, cartilage does not have its own blood supply. So it's like borrowing blood from the environment, from its surroundings. And so you want to increase blood into an area where the cartilage is compromised to keep it moist, because the more the cartilage dries out, the quicker it breaks down. And so you're wanting to hydrate that area quite often. Right. So that blend Joint Relief was actually made for that same kind of issue, like, arthritic kind of conditions. I would use that, and I would rotate it also with German chamomile topically. Like, you could put like 4 or 5 drops in your hand with a little lotion or something, and then just rub it over the area. We can make it in an ointment, or you can make it in an ointment, if you already have it. I usually put about 30 drops per ounce of the carrier. But if you're just making it in your hand, put like 5-6 drops, a couple pumps of like lotion or a little bit of massage oil, rub it together, and then just cover the knee. And that probably will German chamomile reduces inflammation and helps to disperse the fluid in the area so that the lymphatic system can pick it up and get rid of it. It will reduce some of the pain. It will clean up some of the metabolic waste, and then rotating it with the Joint Relief will increase blood flow and circulation to the area, reduce spasms, stimulate lymphatic movement, all those kinds of things. And so the combination of those two should bring you some relief.
Thank you so much.
You're so welcome. And if you have questions about that, let us know, either here or shoot us an email or something, but that should bring you some relief.
Wonderful. And then I think David, no?